Good health doesn't just happen. So we are about to reimagine it. Welcome, everybody. I'm Femi Oke, your moderator for the next 1 hour, where we will be thinking about how do we create better public health systems by working together so much better. We have so many experts for you to hear from, for you to put your questions to. But when we're talking about public health, we're all experts. So you see that Q&A box right there. That is open, not just for your questions, for any of the speakers, but also your comments, your stories, your expertise as well. Use the Q&A box to do that. I'm also going to mention, before we get officially started, that we have interpretation in French, Spanish, and Portuguese. This language that I'm speaking here is South London, so good luck with that, interpreters. You see the little box, the little circle, the little globe at the bottom of your Zoom dashboard. If you click on that, if you want to hear me speak in Spanish, Portuguese, or French, that is what you need to do right now. So let's get our program started. You are about to hear from the President and CEO of Vital Strategies, that's José Luis Castro, and also Her Royal Highness Princess Dina Mired, who is a special envoy for non-communicable diseases at Vital Strategies. José, so good to see you. Where would you like to get started?
Thank you very much, Femi. Vital Strategies was created with a dream and a promise, a dream of a healthier world, and a promise to build and strengthen public health systems that will help achieve that dream. And all the distances traveled since that day in 2004 until today have been traveled trying to perfect that promise and that dream. Our ambitious vision of a world where everyone, everywhere is protected by an equitable public health system propelled us from a paper napkin in New Delhi to 20 years of rapid growth. In that time, we have worked with partners around the world to apply technical assistance to a range of public health issues: smoking, unhealthy foods, road crashes, and the health effects of climate change. This week, Vital Strategies announced our new tagline, Reimagine Public Health. Our determined optimism is a clarion call for a bolder, better, and more equitable approach to health. At a time when health departments around the world are in crisis and public health remains underfunded, understaffed, and under threat, Reimagine Public Health seeks to mobilize a movement that champions the importance and relevance of public health in our everyday lives and restore trust in these essential institutions. Reimagine commits Vital Strategies to build in a future where the many facets of public health and the protections it can afford are better understood by the public and are supported. It is a reminder that everything that surrounds us, from the air we breathe to the roads we cross, shapes health, and the safety cannot be taken for granted. As we look beyond COVID-19, we need to reimagine public health, more interconnected. Today's speakers will speak about that. It is our hope that by investing in public health, we can make so much more progress that seemed insurmountable to the challenges that we face. As we set forth on this campaign and the road ahead, we call on all of you. It is time that we reimagine public health. Will you join us? And now we will watch a short video.
Thank you for the introduction, Femi, and thank you, Jose, for sharing such an inspirational call to action. The pandemic has stretched the systems of all our countries beyond their limits. It has also challenged us all as individuals. We need to think differently about our health systems. I am so honored to join your call to reimagine public health. I know all too well that good health doesn't just happen. Promoting good health and strong, equitable health policies is very personal to me. 2 days before my son's second birthday, Rakan was diagnosed with ALL leukemia. We had to travel thousands of miles to get treatment, as there were no cancer treatment in Jordan in 1997. With the grace of God and quality treatment, I added the most precious title to my name, Mother of a Cancer Survivor. I was well aware that had we not been able to afford going abroad for treatment, our story would have been very different and tragic, similar to the millions of parents around the world who simply do not have the choice for a life-saving treatment. And that is why I work to transform the cancer space in Jordan. And believe it or not, our obstacles for delivering quality cancer care were everything but the actual technical medical cancer care. As we had great doctors, nurses, the complete infrastructure even. Our obstacles were about governance, management, financing, insurance, transportation, etc. So we worked to build coherent, interconnecting systems to actually deliver healthcare to serve anyone who needs these services. And that is why I know firsthand that the intricacies of public health are greater than any single disease. It is the system that delivers healthcare. And that is why I have been part of the movement to address non-communicable diseases for more than a decade. The future of public health demands that we stop looking for a single issue solutions. The future of public health also demands that our health ministries be transformed from ministries of diseases to ministries of health. And this can only happen if we think more broadly about the connections that actually make a healthy society. Health does not just happen. Today, we are asking you to consider how transportation, energy, finance, development, and education are the building blocks to making deep and lasting changes that protect everyone, everywhere. Good health is shaped by a society that promotes nutritious and healthy foods, implements smoke-free areas, makes streets livable and safe for all, and enhances the quality and length of people's lives. This means reimagining how global health organizations engage in the cities and countries in which they work, partnering with all levels of government and across sectors. And this means as well working together with the very people most affected by health disparities to shape the policies needed to ease their health burdens. We have far to go to reimagine public health, but with the leadership we have here today and the voices of advocates from all over the world, we can make good health happen. I thank all of the panelists and our audience for joining us today. Back to you, Femi.
Thank you, Princess Dina. Thank you, José Luis Castro. For our conversation today, you're going to need a hashtag Vital Talks. You see the little Q&A box, it is waiting there for you. I'm excited to see what the very first question or comment is going to be. We're talking about the co-benefits of working together to create a better public health system. So I wanted to give you one little example to start off our conversation. In December of 2013, I was working on a TV show on a very big, well-known international network. And the idea of the TV show is that we connect with our audience. We talk to the audience talks to us all of the time. They suggest ideas for shows, they comment all of the time across multiple social platforms. We were beginning to get comments about people dying in West Africa, in parts of Sierra Leone, in Liberia, And there were these mysterious deaths. And they said, Femi, the stream, please can you look into this for us? We did some research. We were getting more and more feedback from our audience. And we realized that the first show that we did, which was early in 2014, was capturing that very first moment of the West Africa Ebola crisis, because we listened to our audience. The audience told us some information, and then we did a public health broadcasting service to help them understand what was going on, to spread the word, to help healthcare providers do a better job, because more people know that it was Ebola, which of course, you know, is a very serious disease. A little example of the co-benefits of working together for better public health systems. So I'm going to ask our panelists, they've got even better examples than that one, to put on their videos, to unmute themselves, reveal themselves. I'm going to get them all to greet you. I'm going to say hello to Claudia and Dan, Dr. Nandita, Jeremiah, who likes to be known as JP. Ask them one by one to introduce themselves to you, why they're important to this conversation as well. Claudia, welcome. Your introduction, please.
Thank you very much, Femi. I'm so happy to be with you today to reimagine as we need public health. My name is Claudia Driasol Style, and I'm the director of the Urban Mobility Program and the director of the Health and Road Safety Program at the World Resources Institute. Glad to be with you. Thank you.
So glad to have you. Hello, Dan. Please introduce yourself to our international audience and what makes you important in this particular conversation.
Hi, I'm Dan Cass, and I'm the Senior Vice President at Vital Strategies for Environmental Health. We began this program within Vital Strategies about 5 years ago, really recognizing that we needed to be able to address some of the real environmental determinants of not only bad health, but good health as well. I'm really delighted to be here.
Good to have you. Hello, Dr. Nandita. Please say hello to our international audience.
Hello, I'm Nandita Murukutla, Vice President for Global Policy and Research at Vital Strategies. In terms of my contribution to this conversation, while I'm a social psychologist by education, really what interests me is what makes people tick. And at Vital Strategies, I work with my colleagues and partners across the world to study all those influences on people's behaviors, the barriers to their healthy choices, and the means, whether it's in the form of their environments or policies or direct communication, that can help them achieve better outcomes. And I'm really looking forward to unpacking that in this conversation with you.
Thank you, Nandita. And Jeremiah, please say hello to our audience watching around the world.
Hi, I'm Jeremiah Spall, or JP for short. I'm actually, I come from the world of finance, and for most of my professional life, I work in the Ministry of Finance, but that's only late. I mean, 5 years ago, I joined WHO to help them on their health taxes or tobacco control, and particularly on tobacco taxes. So from my standpoint, it's really maybe my contribution here is to how to provide the perspective of the Ministry of Finance officials. If you want to make things happen, they say you always have to involve the people who have the money, and that's the Ministry of Finance.
JP, you're the money man in our conversation. Okay, you're very welcome. We need you. We can't do it without you. All right, panelists, you can speak anytime. If I'm speaking a lot, save me, all right, because you're the experts. I am thinking the reason that we are reimagining public health, healthcare systems, is because our pandemic that we're in right now really showed the fault lines. It really showed where we were failing. We kind of knew already, but it was magnified by the pandemic. My first thought here is, how has COVID impacted the work that you do? How has it changed your priorities? Dan, you start.
Well, I think that to your point about the real sort of challenge to public health as a set of institutions, I think one of the things that it's done is it's forced us to reckon with the fact that we don't have a tremendous amount of power. You know, we entered the COVID pandemic, at least, you know, many of my colleagues in public health, really believing that the institutions of public health were strong and they were forceful and they were credible, and that all we needed to do was sort of follow the science, learn the science, evolve the response in accordance with that. And I think what we've come to recognize is that, in fact, we live in a political ecosystem that does not necessarily support public health. It doesn't, necessarily trust it. That trust can be undermined. It can be both intentionally and unintentionally. And I think we have to reckon with the fact that we have a lot of work to do to assert, our authority with the public, to reclaim our authority scientifically, and to really be in a position to guide, much of the work. I think the last point I'll just make to start off is that public health is a helping institution. It's, apart from the delivery of healthcare, we attempt to inform decisions that exist way outside the scheme of public health, whether in COVID, it's, the sort of service delivery system, but also the economic system and decisions made around whether we lock down and for what period of time, whether schools are attended. And we don't have direct authority. And so our role in public health is to assert the best available evidence and really engage the public. I think Nandita is so skilled at sort of talking about how to really do that, but really influence the levers that exist outside of public health.
Nandita, I think you were writing a note as Dan started to talk. I feel I spied you writing a note. Share your notes with us.
Okay, I was trying to focus myself because there's so much I would like to say. So I'll say three things. One is, I think it made clear the interconnectedness between all the different public health issues. We've been used to working in silos between communicable and non-communicable diseases, and this really, threw that notion out of the window. So interconnectedness being central to public health development to societies and as a system was one of the key learnings that is very much influencing the way we approach public health today. Second is, of course, the human behavioral component. The best guidance developed in a laboratory, if it isn't human-centered, will not work. So if the guidance results in a choice between feeding a child that day and complying with a lockdown, I think the choices are pretty clear. So centering human decision-making needs and balancing that out as a crucial part of public health was the other learning, which applies beyond, I think, COVID and the lockdowns to many of the other guidance that we may put in place, whether it's in food policy, tobacco control, or any other behavior. I'll just echo the trust component of what Dan said. To also add the power of information was really revealed during COVID and continues so, including through all the debacle of Facebook that we're seeing now in terms of how information can be manipulated and result in pretty maladaptive responses. So that's yet another, I think, clarion cry for the future.
One of the assignments I gave our panelists, I make them work, was to bring us a story that is relevant to our webinar today. Claudia, tell us a story.
Thank you, Femi. I want for you to imagine for a few seconds that in order to survive, you will be asked not to see your family, not to hug your grandparents, not to go to school, not to go to work, stay at home and wear a mask all the time. That's the type of radical change that we have gone through for almost 2 years in our whole world. That is the type of radical change that we need for other aspects of health that are happening. COVID-19 has killed so far 5 million people, Femi. But even before the pandemic, we knew that 92% of all human beings are breathing air that exceeds the limits of pollution that WHO accepts. 1 out of 9 people that die because of bad air quality. How many people die every year? 6.5 million people. We as humans need to be physically active. We need to move. Turns out that this generation of children, our children, their life expectancy will be lower than our life expectancy for the first time in 100 years. Why? Because they cannot play anymore out in the streets. The first cause of death for children 5 to 14 and young people 15 to 29 are traffic crashes. Don't we need radical change again? I think so. I think that the pandemic has really told us as humans, you can change. So in this conversation, I'm really looking forward to talking about how we are seeing changes in cities, less people using mass transportation, more people using motorcycles, and people that have the means asking for deliveries of everything, even, rubber bands. So we have to really reflect, what do we want in our cities? And how do we make these radical changes that are in our reach? And I'm going to tell you something. It will be much better than we are going through right now. So I leave you with that. For the
with
next
some hope.
one.
Oh, thank you. We need that. Jeremiah, I am just wondering, JP, the women and men with the money, the women and men with the money and the fiscal side of public health. Has COVID changed their priorities? I know certain moneymakers have made more money than ever before in the past 18 months. Have you seen a genuine impact on the way that money moves around the world because of COVID?
Yeah, of course, a lot of industries have been affected by COVID, and a lot of people have lost their jobs too. But at the same time, those people that have been in sectors like the Amazons of this world, they've generated a lot of money. But what I wanted to stress really is that we should not think of health as just an expenditure. Health is fundamental in any economic recovery, and raising, for example, health taxes, the consumption of tobacco, alcohol, or sugar-sweetened beverages, which are really major risk factors for non-communicable diseases. They should really be, countries should really now be raising these taxes, because more and more countries have never thought about having increasing their deficits tremendously just to respond to the crisis. Or they'll say that we'll think about it later, but we need to deal with the emergency now. But sooner or later, you have to think of essentially funding that deficit. So one low-hanging fruit really is why not raise health taxes, essentially taxes on tobacco, alcohol, and sugary drinks, which are major risk factors for NCDs. So from my perspective, that's one low-hanging fruit for the finance authorities to consider.
Yeah, can I ask you to answer your question, why not? Because some countries have done it, some countries have not. Why that isn't not the easy low-hanging fruit? You come with a solution immediately. Thank you, JP.
Yeah, when you're dealing with malaria, mosquitoes don't have lobbyists. But when you're dealing with these industries, they have strong lobbies, they have deep political and business connections, and therefore it's very difficult to raise taxes at this time, especially at this time. So right now, finance ministries don't want to raise taxes at all. But sooner or later, if they need to have something that improves public health, that should be one of your obvious candidates.
Let's talk, panel, about co-benefits, because that's why we're all here. That's why I've got you from different areas of expertise, because you truly believe that co-benefits will improve the way our public health systems work. Nandita, give us an example that you're seeing right now.
Okay, well, a co-benefit is essentially a win-win strategy. So what we're looking for is a policy or a set of interventions that will yield us multiple benefits. One that we're seeing right now that's been championed by a number of colleagues in Latin America is this issue of ultra-processed products. Ultra-processed foods or products are essentially all those highly industrialized packaged foods that are now rapidly finding their way into low and middle income countries as a solution for the lack of access to food. Bad for health, there's significant evidence now that ultra-processed products result in a number of illnesses, from NCDs to other weight gain and just general ill health, but they also have a detrimental impact on the environment because of the land use, biodiversity loss. There's evidence of greenhouse gas emissions from the transportation of these goods, as well as the wastage that they result. Win-win solutions would be reduction of ultra-processed products, environment shifting solutions such as taxes would make these products out of reach, provide ministries and governments with a source of revenue. And there are other such interventions at the macro level that would be cost efficient and provide a good bang for buck. That would be my recommendation or suggestion for such a co-benefit.
And if I may, Femi, to follow up with a different win-win, I love how you phrase that, Nandita. In the cities, we have seen a wonderful win-win, which is cities putting pop-up bike lanes, providing the space for people that were taking their very old bikes and just trying to use them to be able to move safely because they were concerned about being in public transportation. I think that is wonderful. As I have mentioned before, one of the greatest problems of humanity right now is physical inactivity. And if we can get people to cycle, to walk safely, because it is also a concern with traffic crashes, then we will see the levels of physical activity increasing. And what that means for our life, Femi, it means that we will have less chronic diseases. What is that? Less heart disease, less problems with diabetes, with obesity. And I want to highlight one, mental health. This is a topic that we were not discussing much before the pandemic. And now, if you see report after report, including the Academic of American Pediatricians, has warned that the increase on child mental health issues is just unbelievable. So how can we get these kids to be happier? Being physically active, providing them with good cycle lanes that are safe, that they can use to go to school, or for parents that will not have much money. Remember that this pandemic is throwing 130 million people down into poverty. So I think that can be an amazing win-win if we continue to push for this in the following years.
Yeah, another win-win-win is really in my area, which is really on advocating for health taxes, because it's a win for revenues, obviously, but a win for public health, because again, as I mentioned, that the consumption of tobacco, alcohol, and SSBs are major risk factors, and a win for equity, because the poor smoke more than the rich, or those with lower economic status. So raising taxes essentially raises the prices of these products, making them less affordable. As mentioned, for example, by Nandita, ultra-processed foods. I mean, why not essentially promote the healthier kind of food by providing subsidies, for example, for those types of consumption, and removing subsidies for a lot of these processed foods. For example, I know that there's a lot of subsidies in corn, which is a major major ingredient for many of these processed foods. So all of these things have to be seen holistically.
So JP, you know that would cause a riot. The farmers would be furious if you remove the subsidies.
No, but the farmers, if you reimagine things, that if there's more demand for fresher produce instead of being wasted, right? I mean, they sometimes, especially the big farmers, they produce and they destroy it because it will affect the prices. But why don't we have a system by which we make the small farmers more productive, improve the logistic systems, reimagine again everything, so that at the end of the day, you really benefit the farmers. And why not have food from your neighbor, your next town? I mean,
I hear you.
Think about these things.
Yeah, what you're doing is you're suggesting disruption, right?
Yeah, of course. There should really be disruption.
These are disruptive ideas.
We cannot have status quo. We have to. And I also think that we cannot maintain this overconsumption mentality. We need to take care of the environment. Because
JP, I see Dan is thinking. Dan, articulate your thoughts.
Well, I mean, sort of coming on, based on sort of that, I think, I think a lot about sort of this notion of like the public health co-benefits of climate change. And of course, the starting point is the public health consequences of climate change, which are, enormous. So sort of just to posit a sort of phenomenon, which is that we, in none of our decision-making around climate-related issues, whether it's the current level of fuel subsidies by governments for fossil fuel industry or corn for ethanol, the sort of demand and the response to the need for electricity, industrialization, and none of these things is public health really factored in. And when it is, what you find, and we've done this in our own analysis of vital strategies, when you look at the potential savings in terms of lives saved, hospitalizations averted, children who thrive, throughout the life course, from avoidance of stunting or low birth weight. And when you look at these benefits that are associated with even just like the air pollution impacts of climate emissions, the savings alone more than pay for the cost of the interventions necessary to green the economy, to convert fuel systems, to invest in renewables. And so a clear co-benefit here is that we need to think, at least in the climate space, we need to think about the potential public health benefits of decisions that we have to make now. We're about to come into COP26, which is the international gathering of countries to make their pledges and describe how they're going to sort of get to carbon neutrality by 2050 or whatever date they describe. There are choices that public health can inform right now about how we do that. Just a quick example, in a country that's dependent on coal for producing electricity, we know the consequences of that. Coal is one of the leading contributors to air pollution and avoidable death, globally. So if you're going to invest in a greener set of technologies, whether renewable or natural gas, to convert these things, doing it in a coal fire power plant that affects the air pollution in a city, in a population center, as opposed to one remote, where the air pollution benefits aren't accrued by people. Climate benefits are, but not the air pollution. That can make an enormous difference. So there are just concrete examples of how public health can really inform decision-making in the near term. And then the sort of last piece of that from a co-benefit perspective and a climate perspective is we don't have a level of sort of popular support yet for the urgency necessary to address climate change. Making the benefits known to people in the near term. Now, your air quality is going to be better. Your water quality is going to be better. You're going to have, greater access to energy. Those things will drive public support for the hard decisions that have to be made, like in the immediate sense.
Yeah, just a quick question, because I've faced this issue when I was in my previous life, and we were really pushing for higher fuel taxes so that the reduction of air pollution, and that's there. But the question really, or in the case of power, right? So, but the question that was raised was, who's going to pay for these adjustments? Would it be the consumers? Because you're going to face a riot, right? So how do you deal with the transition? That's really was was a question that many were asking.
And what did you answer? Dan, you go ahead. What would the answer be?
Well, I would just sort of put out there, again, sort of coming into COP26, that, you know, countries have still yet to ratify what's called Article 6, which is a pricing scheme for carbon. You know, and economists globally have, you know, sort of near consensus that the equitable, you know, the least regressive way to reduce consumption is to and emissions is to properly price carbon. You know, factor in all of the social consequences of you know, business as usual and climate scenarios, and price carbon accordingly. Then it's distributed throughout the economic system. It's paid by consumers. It's suffered by the producers. It's you know, it incentivizes investment in alternate technologies. So, you know, my hope is that we come out of COP26 with a clear agreement that that's what we have to do.
I love that whenever anybody says climate, Claudia brightens up. She sparkles. She's jumping off the screen. Claudia, go ahead.
Thank you, Femi. I think it is a little bit the boiling frog syndrome, doesn't it, Dan? It is until we are not pushed against the wall, as we have been in the pandemic, we don't get the greatest minds to come up with a solution like the vaccine. But we are getting in a very bad shape in terms of public health. And what we are seeing in cities, what I'm telling you, cycling, it seems like it's so in our reach to be able to do it. And we just have to make it safer. The investment is going to be a lot lower than providing infrastructure for cars. But we still have to push, and we see 1 kilometer at a time added when we need to have networks. Now, what will be the impact when we talk about cycling? We have a researcher, Christian Brandt, from Oxford, that has made an amazing analysis. And what he has said is, look, cycling is 84% lower CO2 emissions than using a car. So if you personally want to do a contribution to climate change, you can shift. But of course, we are not going to ask people to go and take a bike or, you know, ask their children to bike when it's unsafe. We really need to make that shift. What we are seeing in COP26, and that is a little worrisome in the transport discussions at the urban level, is that we are kind of over-focusing on electric vehicles where we need them, but they're not going to come fast enough to help us with keeping the 1.5 degrees Celsius to save our lives, to save the ecosystems that we need. So how do we do a little bit more of the good things that can happen right away, like, you know, make the streets safe for people to be able to walk and cycle, and a little bit less than the bad, to quote again Brandt.
Webinar audience, what are you thinking? I see you. Put your thoughts into the Q&A. They don't necessarily have to be questions. They could be thoughts. I will share them with the panel. I'm coming to you next. But first, Nandita, tell us a story.
Okay, but if I may, I want to just pick up on this conversation because I find it incredibly interesting conversation around financing. And speaking of the interconnectedness of how we finance development at large, I want to mention a piece of work that colleagues at Vital Strategies and I did earlier this year. We published this as a report called The Sobering Truth, and it's about the alcohol industry, wherein we found that while the health harms of alcohol are really well known, established, not just the diseases that or the harmful use of alcohol can cause, but the injuries and the violence that can result from the abuse of alcohol, we found evidence of public investments in the alcohol industry. So not just private investments, but public. So here we have governments strapped for cash to respond to a public health crisis, while on the other hand, other departments within that same government are financing alcohol industries. Get more more egregious, we
Yeah.
found evidence of a lot of these flows going from high-income countries to low and middle-income countries under the guise of overseas development assistance, but the recipients often finding their way back to large transnational alcohol corporations that are many-fold the size of those investments in terms of their annual revenue. So the interconnectedness of how we finance public health, how our system operates, really requires a re-examination, because there are very insidious ways in which we're financing our own ruin. A story. I'm a mom of 3 children. I think about their foods way more than their meals way more than I'd like to, and I'm incredibly grateful to school meals. And therefore, I was, in addition to the convenience in my life, recognizing how it addresses equity issues by providing nutrition to children, and also recognizing that it's a hard thing to measure the impact of school meals. I was astounded to come across this study earlier this year that looked at the impact of school meals on children, and not only found impact in to the recipients, but actually many years later, the intergenerational impacts that one intervention can yield. So politically very good if done right, but and free from all those commercial interference that would try to manipulate dietary guidelines in school meals. But if done right and done well, it has astounding long-term impacts, and the return on that investment is astounding. So I'll offer that.
And thank you. We accept that story. Let us go to some of your thoughts, your questions, webinar audience. Thank you for putting them in the Q&A box. Karen Smith.
Picking up on Nandita.
Jeremiah, make it quick, because the webinar audience have questions for you. Go ahead.
Okay, sure. No. I just wanted to pick up on Nandita's point of this, the need for policy coherence in government, because in many times they work in silos, and therefore they have their particular key result area, but at the end of the day, they really need to work together, because what is the common vision? At the end of the day, they have to agree that public health is really very important, that because a healthier population is a more productive population, which leads to a wealthier nation.
JP, you are stating the obvious. Why is it not obvious to governments around the world? Let me just ask, has anyone seen this idea of governments working intersectionally across different areas so that they connect, so that the work is done better? Claudia, have you seen that?
I'm just thinking, I have seen, for example, in Denmark, a little bit more of a consideration, and going back to the topic that I love, cycling, to see that funding is coming from the heart associations to cycling, because they know that if they fund this type of interventions, it can get better. However, I have not an example where you can see the Minister of Finance really deliberately putting resources into certain areas, like improving food or lowering the consumption of alcohol or improving infrastructure in cities, because he's thinking about health. And I precisely think that that's the connection, the reimagining that needs to happen. Once we connect those indicators that we want to see in the finance, then I think we are able to see the results. Otherwise, it really seems like we carry forward with these models that have sat there for tens and tens of years, and we are not seeing much change.
Yeah, I have some experience in that, because when I was working as a senior official in the Philippines, there was at the time we had what they call a synergy budget, wherein if 2 or 3 departments work together and propose a project. So we were essentially, at the time, government was encouraging departments to work together, so that, for example, if there's a budget of the infrastructure that can be used for water, because safe water, for example, just avoiding the the diseases, waterborne diseases, would really have a big public impact. So those things, and in other words, if you work together, you get a bigger pie of the budget. So those were the innovations that I could remember when I was in government.
And now, webinar audience, you've been very patient. I'm not going to let the panelists talk about anything else other than your questions now. All right, this is the rapid fire round because I want to get all of your perspectives on all of these questions. So be efficient with your replies, panel, if you would. Okay, so Karen asks, if there was one aspect that you could address most urgently, this idea of reimagining public health, what would be the one thing you would do immediately? Nandita.
Sorry, I would address ultra-processed products because they're rapidly finding their way into low middle-income countries where they may not exist to that level. So the chance is now.
Dan, one thing, immediately, you could do it today. What would it be?
I would vote out every elected official who didn't make an immediate, codifiable, enforceable commitment to reducing carbon emissions.
Oh, I wish you were in charge, Dan. That is so fantastic. Claudia, one thing, urgent thing you would do today.
I will reduce the speed in cities to 30 kilometers per hour. Look at Paris. We have 1 million people cycling.
Jeremiah, your one thing, urgent.
Yeah, I would essentially urge ministries of finance and health to work together to raise health taxes, because it's really a win for revenue, so win for health and a win for equity, and not be afraid of the industry scare tactics.
This is a question for Claudia. Claudia, you've spoken about bike lanes so enthusiastically. Stephen wanted to ask you, it seems like bike lanes have really exploded in many cities during the pandemic as people wanted to avoid mass transit and streets had fewer cars. Has this been a global trend? Have people got on bikes all over the world?
Yes, Femi. From Buenos Aires to Lima, we have seen them in Kampala, in Bangalore. I know that the government in Vietnam is rethinking completely the transportation and really trying to go back to cycling again. Yes, it is very encouraging to see what has happened. Now, what we need to do is really continue with this trend and just make it permanent as a response not only to our public health, but to climate change, which is really the next big threat that we have in our lives.
Oh my goodness, another Viking question. Claudia, you're so popular right now. Getting back, this is Janine Babakian. Getting back to what Claudia said about cars, I think that those of us who do not, in parentheses, yet drive electric cars, we need constant reminders every time we reach for the car keys. Do I need to drive right now? What can I do to combine trips or walk or bike? I think that cutting back on car usage, at least in the US, is a part of people's mentality. Can I ask you, do you mind doing a show and tell? Claudia, do you ride? You've got to after all of this advocacy.
Absolutely.
Yes, all right.
Absolutely. And you know, I'm going to answer to your question. 35% of all the trips around the world are 5 kilometers or less. And 50% of all trips are 10 kilometers or less. So the reflection that you have about, do I need to make this trip to the grocery store with my car? Can I bike? Maybe I cannot bring all together in once, but maybe I can do 2 trips or 3 trips. I really challenge you to do that because it will make your day a happier day.
So biking is not for everyone. So I'm just wondering what you changed during pandemic. Dan, I walked a lot more. I went hiking. Dan, what did you do?
Well, good for you. I sat around a lot more. I worked
Yikes. Thank you for your honesty.
No, I mean, I you know, my contribution was that, you know, I traveled a lot less. We figured out new ways of doing our work that didn't require us to, you know, country jump all the time. And we depended on more local people, which ended up being a really, you know, sort of which is a very good model for all of the international work that we do. So there were some benefits attached to this, but I would feel irresponsible if I didn't just throw a little bit of a cloud over this notion that individual decisions matter as much as they do. You know, these solutions require systems, they require policies, they require, you know, sort of enforcement and incentives. People can make individual decisions, but it's the ecosystem that informs those decisions. And so I wouldn't want to take our eye off the prize of real systems change and policy change.
But Nandi, let me bring you in on this next question, because it is about systems change. This is Nana. Nana, thank you. This is such a fantastic question. Nana is wondering how much more information policy and decision makers need in order to make the right decisions. Perhaps part of the gridlock comes from the very systems we have set up and rely on to solve the problems we are facing across the board. Nandita.
Trust Nana to ask the complex question.
It's pretty complex.
The talk in itself. I agree entirely, and a couple of things I will add here or offer. One is the timelines on which a lot of our policy decision makers work. They're short-term timelines versus a lot of the systems level decisions we're describing here that are much longer term timelines. And so what are the ways in which we're incentivizing the right decisions or not is, I think, an important consideration for us to think about. And do we rely, where in the system do we rely on the right decisions being made? Another piece in this I would offer is a deep consideration as well as an education of both policymakers, consumers, the media at large, on the influences on those political decisions, in particular the commercial drivers of those decisions. While it's all fair, and this is certain commercial drivers, it's not to say that all commercial drivers or determinants of health, the private sector, are bad actors. That's not at all the case or true. But in certain situations where the core business is the sales of certain unhealthy commodities, those actors cannot be at the policy table. So there are some of these ways in which the system itself can respond better to the question.
I have a question for you from Rebecca JP. JP, have you ever had any success convincing ministers of finance raising taxes on unhealthy commodities? And if so, where specifically?
No, there have been a number of countries that have recently raised taxes.
I think Mexico on like soda and pop. I think
no, that was a few years ago. Yeah, soda, they did that. But under the COVID times, Russia, for example, raised taxes, and South Africa. But a number of ministries of our finance are thinking about it, but it's a question of timing. I think it's not a question of whether they will increase these taxes or not. It's a question of when, because they really need to make sure that they have responded well to the COVID. I mean, if you're a policymaker, you have to balance many things, but I don't think it's a question of if they will raise taxes. It's a question of when. The timing is important, and how do you communicate it? Communication is very important, because if you frame it just as a revenue measure, you won't get anywhere. But if you frame it as a health measure, it's good for public health, and link the increased revenues to public health, for example, that will get more buy-in. The same thing maybe in the case for cycling, biking and cycling. If you frame it, the same thing for food, the same thing for climate change. I think that framing is really important, that something that resonates really, and political will, getting political will at the highest levels is really
political will is the answer to all of our problems, every single one of them. All right, so Sarah Gardner. Sarah, you've given us an epic question, but I'm only going to give the panel 30 seconds to answer it. All right, panel, I know you're up to this. How do we rebuild trust in public health and public health institutions? Give us an idea, Dan, just in 30 seconds.
I think it's a good question, but I don't think it's necessarily one with an easy answer. I feel, when has public health made the biggest difference in the world? It's made the biggest difference, not because it's a standalone institution, but because it's been able to align itself and ally itself with mass movements demanding improvements in housing conditions and living conditions in the environment. And I think what we really need is sort of to look outside of the institutions of public health and more at, sort of what can we do to basically support the kind of demands that the public is making. And then one little thing, which I've been saying sort of for a long time, and I feel it even more strongly, it sounds silly, but if we could find a way to teach epidemiology in primary school, I feel like we can inoculate people against misinformation.
Wow. Nandita, very briefly, rebuilding trust in public health institutions.
By following a scientific process, and by that I mean a true scientific process in which there is an admission of getting it wrong and a process by which that is described and corrected and builds upon what's now new information that's known. So I think the transparency and a clear process is one of the ways.
Panel, I have been looking at just briefly there at the hashtag Vital Talks and seeing the conversation that you've generated help add to. You all know that a tweet is only 250 characters long. So I'm talking about 2 sentences, okay? Just 2 sentences. Here's your tweet. Well, here's the question for your tweet, and I'm interested in your reply. How can we reimagine public health together? What is your tweet, Claudia?
Bike. Think about how climate change will be better. Bike to be happy. Ask your mayor to make it safe.
Nandita, your 250 characters, deliver them.
Okay. Well, public health is a decision that is woven into every aspect of our lives, from the air we breathe, the foods and drinks we consume, to the roads we travel.
JP, you only have 250 characters. I know you can do it.
So that's a tough one. So I would rather say be bold, be smart, go smart tobacco, smart taxes. In other words, it saves lives, mobilizes resources, addresses health inequities, reduces health systems burdens, and targets NCD risk factors. I don't know that that's...
Oh, that's a threat, JP, but we'll allow you to have that. Okay. Dan, bring us home. 250 characters. Unmute yourself. You can't cheat by doing a longer tweet by muting yourself. Go ahead.
Act like the world's on fire because it is.
Oh, that's the tweet. This event was brought to you by the team at Vital Strategies. Thank you, team. Thank you, panel. Dan, Nandita, Claudia. I'm going to call it a Claudia bike. Get biking. JP, thank you so much. Thank you, audience, as well. You can see the entire recording, because I know you'll want to share this with your friends, at vitalstrategies.org. See the recording there, find out more about Vital Strategies, and also find out more about the team at Vital Strat on Twitter. Thanks for your time today. Take care.
Thank you.